system or we can try something new. A public option that you've heard here today that has brought so many of you out today is that something new. For many here who came and you've got employer-provided health care, you keep it, you keep your doctor, you've got Medicare, you keep the plan you've got now. But for the 1 in 4 of our neighbors here in Texas with no health insurance, for the 24,000 additional Texans who lost their coverage, who lose their coverage every month, or the many who have insurance with the fine print taken away most of the through the exceptions, most of what's in the policy, you'll finally be able to get access to a health insurance policy that will work for you through something called a health insurance exchange. That exchange, it's kind of a funny name for a marketplace, is not very different than if you turn to a website to compare prices for airplane tickets. You're able to go there and look at the various policies that have to meet a minimum set standard so that it doesn't deny all your rights. And you can compare policies and see which one has the best premium for you, the best coverage for you. And for the first time, when the uninsured begin comparing those prices on the private policies, they'll be able to compare them to a Medicare-type public plan. That public plan is optional. It's not something you have to do, it's something you can do. It's about more choice. It's about competition, because in so many of these markets, there's only one dominant insurer out there. They don't have any real competition. This can provide the competition. The idea has been advanced of, well, maybe what we need to do is to have a co-op instead. We got a little experience around here with co-ops. Some of them do a really good job, and if you were in Burton Alice, some of them didn't do such a good job. What we need is a bigger alternative that can stand up to these insurance companies. Let's not be co-opted. We know, sitting where we are today, that David may well have defeated Goliath, but we need to go out with these giant insurance companies with more than a modern-day slingshot if we're going to have a fair chance. Who denounce the public option as a government takeover, and who insist, that some did at one of my town meetings, that the 10th Amendment bars federal involvement in health care, have made it clear that they would repeal Social Security and that they proudly oppose public education. They call government hiring of doctors and the construction of federal clinics and hospitals, which this bill doesn't do, but our law does for our veterans. They call helping those veterans socialize medicine. I call it fulfilling a responsibility to those who attended the freedom. When Lyndon Johnson was faced with the same arguments, he overcame them for Medicare, and Medicare has saved so many seniors and their families from disgrace and poverty in their final years on this earth. It has been a success, and now we need to do a little of that success for the rest of America. As the insurers work now and in the coming days to bury this reform, today America buried a giant, Edward Kennedy. He called health care the cause of his life, and he said he had new hope that we will break the old gridlock and guarantee that every American will have decent quality health care. He envisioned an America where no citizen of any age fears the cost of health care, and no employer refuses to create new jobs or cuts back on current jobs because of the high cost of health care. We must fulfill that vision with meaningful reform, and I hope it will bear the name of Edward F. Kennedy. Days, Libby and I will be returning to Washington, inspired by the example of public service of Senator Kennedy, but also inspired by you. So many people here in this great room today and in our overflow crowd are here because you really care, because you recognize that together we can make a difference, that your presence indicates we are not going to back down. With the help of With the health insurance industry spending more than $1 million every day to kill the public plan, and that's what's happened in the second quarter of this year, we've got a great deal more work to do between today and getting this public plan and comprehensive reform adopted. This bill is not moving too fast. It's 60 years too late. What specifically can you do? Insist on a strong public plan and don't accept any substitutes. When the opposition emits heat, you shed light. Use every available forum. Reply through letters to the editor. Call into talk radio. Post, blog, tweet, whatever you do to put the record straight. Participate in community meetings. After all, health insurance reform is fundamentally about pooling resources, and that's what we're doing this afternoon, pooling resources to get Washington to act on what it should have done a long time ago. And remember, this is not just about persuading elected officials directly about this urgency of reform. It's about educating our neighbors. It's about educating folks in our churches and places of worship. It's about educating our friends and our families that the time to act is now. With humility and with faith, with compassion for our neighbors, let's rise to this unique occasion to win now what so many others for so long have failed to accomplish. Yes, I'm convinced together now we can. Thank you.